How is localized stage I lymphoma diagnosed? Imagine trying to solve a puzzle where each piece reveals more about what's happening inside your body. When doctors suspect lymphoma is confined to just one area, they follow a careful process to confirm this. First, they start with a thorough physical exam, checking for swollen lymph nodes in common spots like the neck, armpits, or groin. They also review your medical history and ask about symptoms such as painless lumps, fever, night sweats, or unexplained weight loss, which can hint at lymphoma. Next comes the tissue biopsy, which is the key to a definitive diagnosis. Usually, a surgeon removes an entire lymph node or lesion through an excisional biopsy, allowing pathologists to examine the tissue architecture closely. This detailed look helps identify lymphoma cells and determine the specific subtype. Sometimes, less invasive options like core needle biopsies are used, especially if surgery isn't possible, but they may not always provide enough tissue for complete analysis. Fine needle aspiration is generally not enough on its own because it often doesn't give enough information to confirm lymphoma. Once the tissue is collected, specialized laboratory tests come into play. Pathologists analyze the sample under a microscope and use techniques like immunohistochemistry, flow cytometry, and genetic testing. These tests help classify the lymphoma type, which is essential for planning treatment. To see if the lymphoma is truly limited to one area, doctors use imaging studies. Computed tomography scans are common for visualizing lymph nodes and organs, while positron emission tomography combined with CORT scans, known as PET-CT, are especially useful because they detect active lymphoma cells and show if the disease has spread. Magnetic resonance imaging may be used in specific cases depending on where the lymphoma is located. Sometimes, a bone marrow biopsy is performed to check if the marrow is involved, although this isn't always necessary for stage I lymphoma. It's more common if the subtype is aggressive or if PET-CT results are unclear. All these findings are then combined using the Ann Arbor staging system. If the disease is found in only one lymph node region or a single extralymphatic site, and no other areas are involved, it is classified as stage I. The presence or absence of systemic symptoms like fever or weight loss is also recorded, which helps determine the overall stage and guides treatment decisions. In essence, diagnosing localized stage I lymphoma is a detailed process that involves physical exams, tissue biopsies, and advanced imaging. This comprehensive approach ensures that doctors understand exactly where and how the disease has spread, so they can plan the most appropriate treatment. If you or someone you know is going through this, always consult healthcare professionals for personalized advice and care.